For the past 4 years, when I first came here, I could barely hardly walk. Barely hardly walk. Barely hardly walk. Barely hardly walk. Barely hardly walk.
Hello, I'm Norberto Cancel, and I'm here at Advance Pain and Wellness in Jersey City, New Jersey. I'm here sitting with Dr. Luis Aranguren, and he specializes in pain management. Hi, doctor. What inspired you to specialize in pain management?
Well, I'm first and foremost a patient myself. I suffer from an autoimmune condition, and that's guided me through my whole career to try and help people that are suffering from similar symptoms.
So can you tell us a little bit about your journey, the education, training?
Of course. I'm born and raised in San Juan, Puerto Rico, where I did med school. I did my residency near Tampa, Florida, and my pain fellowship in Chicago, Illinois. And now I work here in Jersey and as well in Puerto Rico.
Okay, so what's the difference between acute pain and chronic pain?
So acute pain comes evolutionarily to try and save us. That is the pain when you sprain something, and that guides you to be careful and take care of yourself. However, when pain lasts more than 6 months, that isn't fulfilling that criteria, and that's something we need to work on.
And how do you assess and diagnose the root causes of chronic pain?
It's super important to see the patient as a whole and everything that is going on with them. That includes the physical exam, their history, the imaging, and treatment that they've had, and that helps guides us to the root cause of that pain.
So what's your general philosophy on managing pain? Do you focus more on medication, lifestyle changes, or interventional procedures?
So we try and do what we call multimodal pain management, which includes medication, physical therapy, and the procedures. If we can do as little interventions as possible, that would be best.
And how do you balance the need for pain relief with concerns about opioid use?
Well, like I tell my patients, opioids in the long term isn't the best alternative because we are not treating the root cause of the pain. We are just helping them while that medication is taking effect. So that is a good tool in the short term to help alleviate the pain, but we really need to find what's going on and try and cure that.
What are some of the most effective non-opioid treatments currently available?
Well, what we call NSAIDs, the nonsteroidal anti-inflammatory drugs, are excellent, especially in combination with muscle relaxants. There's also the gabapentinoids like gabapentin and Lyrica, and we have also other medications like low-dose naltrexone, which help with inflammation.
And can you explain some of the interventional procedures you perform?
Sure. Most of my procedures involve the spine, whether it be for arthritis or for pinched nerve, and that can be done in the cervical area, thoracic, or lumbar. And depending on what the patient is having, we can also do epidural blocks, which help with discogenic pain, pinched nerves, and pain that shoots down either the legs or the arms.
How do complementary therapies like massage or physical therapy play in your practices in pain management?
They play a really important role because we can do a procedure like a block to try and help alleviate that pain acutely. But after that pain has improved, we really need to get the patient in better shape and moving better so they don't fall back and get that same pain that they had before.
How do you treat patients who don't respond to conventional therapies?
Well, that's when we really want to do a deep dive and see what's going on because most of the time they should respond to all of these therapies, but there could be something going on, something autoimmune, something systemic that we haven't actually seen.
Are there any new technologies or breakthroughs in pain management that you're particularly optimistic or excited about?
For sure. There is a lot of headway being made in peptides, which can modulate inflammation in a lot of different ways without having to resort to our typical therapies.
How about digital health tools like telemedicine or pain tracking apps? How does that fit into your practice?
That helps us out a lot. We use a program called the PDMP, which every state has, and that tracks what narcotics have been prescribed, and that lets us prescribe in a safe manner so that the patient has as little risk of overdose as possible.
What are the common misconceptions people have about chronic pain management?
That there's not something else that can be done. There's always something that can be done. There's always a new treatment, a different combination of things. So don't lose hope. There's always something that we can help with.
So what advice would you give to someone struggling to find effective pain relief?
Again, don't lose hope. We can help. I've been there. I've been told that it's all in my head, that nothing's wrong, and that's just not true. So come give us a shot.
Okay, lastly, could you share a memorable experience where your treatment made a significant difference?
Oh, for sure. I had a patient in their late 60s, came in with many years of pain, has had blocks done in the past, and nothing really helped in the long term. After evaluation, I saw that their labs were showing inflammation. So I did a combination of blocks to help in the short term and treat the root cause of their pain and inflammation, and they've been doing great.
Fantastic. Thank you, Dr. Lewis, for meeting with us. Again, folks, if you're suffering from severe pain, chronic pain, or acute pain, please visit us here at Advanced Pain and Wellness in Jersey City and see Dr. Lewis.